Good morning, everyone. You're watching Barnstable this morning, and I'm very pleased to welcome in studio today Cheryl Bartlett. Cheryl is the new Executive Director of the Cape Cod Regional Substance Abuse Prevention Initiative and Public Health. Cheryl, good morning and welcome to Barnstable this morning.
Good morning. Thank you for having me.
Thank you so much for coming in. So Cheryl, I wanted to talk a little bit about your history in the health industry. Most recently served as Commissioner of the Department of Public Health. So tell me a little bit about your past history and involvement with issues in terms of public health.
Well, I probably started my public health journey as the founder of the Nantucket AIDS Network about 25 years ago on Nantucket, which eventually got me up to the Massachusetts Department of Public Health in 2008 when John Auerbach was commissioner. And in that 6.5 years that I was there, I was promoted 4 times to various positions of leadership, and eventually in May of 2013 I took over as commissioner. And I think a theme throughout my career has kept bringing me back to the issue of substance abuse and substance abuse prevention. And as commissioner, Governor Patrick and I declared a public health emergency around opiate overdose deaths and just the use of prescription opiates in general that are usually a path to heroin. And in that experience, I've really been fortunate to go across the state as well as the nation to really learn what this devastating public health issue is doing to our communities, our families, and to individuals who suffer from substance use disorders.
How have you seen the issue change over the years?
So I guess I would say if you look at what happened 20 or 25 years ago, most people's experience with opiates recreationally were heroin. And that was often a deterrent for most people to realize that heroin was probably a bad choice to make. Now what we're seeing is probably 70 to 80% of people that wind up using heroin have had their path start with a prescription opiate. And a majority of those prescription opiates were something that a friend or a family member gave them that weren't their own prescription. And if your brain has the sort of predisposition to become addicted to opiates, then very quickly people move from a prescription opiate addiction to heroin because it's so much cheaper. One prescription opiate on the street, I've heard, is anywhere from $30 to $80 a pill, and a bag of heroin is anywhere from $3 to $10. So a really sad path that happens often.
Absolutely, and really kind of terrifying, you know, as you think about heroin as a deterrent. And, you know, certainly it's a big decision to want to take a drug and, you know, like that, go to the lengths that you need to go to obtain it, and then all the various ways in which to ingest it, you know, scary ways.
Yes.
But taking a pill is something that a lot of us do every day.
Right, and they're in our medicine cabinet, so they're legal. And one would think that if the parents have a bottle of some kind of pill in the medicine cabinet, it probably isn't that bad for them to take.
Absolutely. So, you know, there's certainly no question we really are in the middle of a crisis when it comes to substance abuse. We're seeing overdoses, multiple overdoses every day here on Cape Cod and Barnstable and Yarmouth and Falmouth and really in all of our towns. So talk to me a little bit about how you're going to be working with the Regional Substance Abuse Prevention Initiative and the hospital and Cape Cod Healthcare to try and help to solve this issue. What kind of things can be done almost right away, if anything?
So I sort of see 2 tracks. One is coming up with some short-term strategies that we can implement right away so that we begin to get some messaging out there about how unsafe prescription opiates are for parents and for youth, while at the same time really working with the community. The county, as you know, most recently got a large $500,000 grant for an over a 5-year period to try to help organize the community into creating a multi-sector plan to address this, anywhere from prevention to treatment to public safety. But that will take a little bit longer time period, and I think we're anxious to get out there and start to do some things while at the same time coordinate with all the existing people who have across the Cape for a long time been interested and or working on this issue. So really a leadership role. It's really innovative for a health system to bring in a public health professional to try to connect the work that they do to improve health to public health approaches and community health. So I see this as a really exciting opportunity to link the community and the healthcare system together.
Absolutely, and you know, as you just mentioned, talking about how people have been starting with these prescription pills, you know, that probably weren't prescribed to them. Is that a facet that is going to be discussed perhaps with some of the prescribers, the doctors, taking a look at to whom and at how much of a quantity these pills are prescribed?
Yes, that's a conversation that many of us have been having nationally. Do we need to put some sort of guidelines in place that say if you're going to have a minor dental or other surgical procedure, do you only get a week's worth of a prescription? And if you're still not well, do you go back to the doctor? That provides some sort of disincentive to overuse them. And I was very pleased to see that the physician providers, the preferred provider group here on Cape Cod, has an opiate prescription work group where they're really talking about these discussions amongst themselves. And I have to say that in all my travels across the state, I haven't seen the doctors coming together as organized as I've seen this particular group of providers and try to develop some voluntary guidance. And I think that it's really wise that prescribers begin to look at what the prescribing practices are that really can lend themselves to impacting this epidemic.
Sure. Let's talk a little bit about prevention. Of course, I think you know, it's something that I would assume has to start really young. You know, once the kids reach the later high school age, they've probably already considered experimenting or have seen their friends do so. You know, in terms of prevention, how young would you imagine starting talking to kids about substance abuse and the dangers that surround it?
Well, what we've seen in our substance abuse programs that the state funds, that 40% of those who are admitted for treatment are between the ages of 13 and 29. So as you can see, we really have to get into that, I would say, middle school easily as a starting place to begin to have these conversations and let them know about the risk factors. And there's clear evidence that with a lot of high-risk behavior, tobacco use, alcohol use, the longer you can delay somebody experimenting, the more likely they won't go on to be addicted or have long-term use of those substances.
Absolutely. So when we talk about, you know, not just the prevention, but everything involved in the work that you're doing, you mentioned a lot of partnerships, and obviously you're working with Cape Cod Healthcare, but talk to me about some of the organizations that you're hoping to partner with to try and kind of get that collaboration to help deal with the issue.
I think I started out really focusing on those people that are already working in this field. So, of course, I've had a long-term relationship with Gosnold and Ray Tomasi, and he's really out there doing some innovative work. I think the county, again, has been a leader in bringing a collaborative of people together and facilitating a conversation. And I've been meeting with the district attorney, with the sheriff, with individual professionals that either practice in their communities or practice as part of a provider group, and learning about what they're seeing out there, what they think are the big issues, so that we begin to understand what kinds of patterns of use, who's using, and then what some of the consequences are that are related to those activities.
Sure, and of course the substance abuse issue has been, as you mentioned earlier, declared as a public health crisis, and I think it's pretty obvious to see why. But can we talk a little bit about what led to that decision to say, yes, you know, we need to make an official declaration that this is a public health crisis? What goes along with that?
And so what we began to see at the end of 2013, excuse me, we're in 2015 now, and the beginning of 2014 was a significant rise in overdose deaths, and in communities that hadn't had any kinds of activity of this nature in the past. And so in particular, the mayors started really ramping up the cry to say this is really serious in our communities. And so I began to meet with some of the mayors. Senator Markey came to town. We held our first roundtable in Taunton, I believe last February, where we started to really focus attention on what was happening. And so with all of that concern, I started to meet with the governor. I brought in people that are in recovery, people that are family members of people that have struggled with addiction, so that he could understand just how impactful this was. And at the same time, there was a new drug that was about to come to market that was a real pure opiate, and that if it was abused would really probably increased the number of overdose deaths that we saw. And we felt like we really needed to take some action to put some policies in place to manage how this drug would be used. We first tried to actually ban it. We were very bold here in Massachusetts, but what I think it did is really create a loud conversation across the nation that we took these bold steps, and we then began to organize a new Northeast Conference of Governors so that we could look at having some of these policies be across state borders.
Great. So obviously a lot of work ahead of you, Cheryl, and certainly not going to be an easy issue to solve as it is so multifaceted. What do you see as kind of some of the largest challenges that you're going to have to overcome as you go into battle on this?
Yes. Well, I think first it's trying to get people to the same table and collaborate. Everybody in goodwill, in good faith, is trying to address it from their own perspective, and sometimes that can fragment a system of care, so trying to be aligned, coordinated, and collaborative. And then I think identifying what the resource needs are. And I think one of the things that, while the Cape is on par with the kinds of substance abuse activities that are happening across the state, we're very under-resourced here. So really finding enough resources to implement a comprehensive public health approach.
This year, you know, what are you hearing the most from the community as you meet with them in terms of their concerns about this issue?
I think obviously overdose deaths is the clear number one. People are just frightened by the number of deaths that they have. I think that trying to prevent youth from initiating any kind of recreational drug use is critical. And then I think access to treatment. We hear that over and over again, that there aren't enough beds, but I think sometimes that's really synonymous with people don't know how to link up with the system or don't know what they need, and so if they can't get a bed, then they think that there's nothing else out there for them. And I think if there's one thing the Department of Public Health could do better, we learned that by going across the state, is to inform people about what's available already for them. We are one of the best states in the nation for access to treatment and for some of the innovative programs that we have, but certainly we need more of it and more accessible.
Absolutely. Well, Cheryl, I thank you so much for coming in and talking with us, and I hope to have you back on the show as we continue dealing with this issue, and I wish you all the best.
Great. Thank you so much.
Thank you. Cheryl Bartlett is with Cape Cod Healthcare. She is the Executive Director of the Cape Cod Regional Substance Abuse Prevention Initiative and Public Health. For Barnstable This Morning, I'm Sarah Colvin.